We are back talking about myopia and any other vision related questions you might have. We're going to start right here with Dr. Orr. How often do you need new glasses?
So since we do recommend that people come in once a year for their eye exams, glasses prescriptions will often expire at 1 year as well. We just want to check on if things are changing and how we can help you see your world more clearly. Some people, if their vision hasn't changed much, can get a little bit longer life out of their prescription, but usually once a year is what we want to check on.
Okay, and why does myopia typically worsen in childhood and stabilize in adulthood?
Yeah, that's a great question. So usually, when kids are growing and changing and all of their growth spurts, that's when that eyeball will tend to get longer and longer. And then once we're done growing, that's when things stabilize. So most of the big changes for myopia in children will happen between the ages of 8 and 13.
Okay, and we have a viewer question here. I had retina surgery for a bad tear. Now I have the beginnings of cataract on one eye and glaucoma on the other. What causes all of this?
Yeah. So when a retinal tear happens, it usually requires surgery to repair that. And unfortunately, the surgery is just kind of rough on the eye. And so in that process, it can cause a cataract to develop more quickly. That could also be the cause of glaucoma, but the glaucoma could also be caused from previous trauma or just genetic factors.
Another question from a viewer, is there any way to reverse myopia in adults, such as making the shape of the eyeball less long?
Yeah, that's a really good question. And I think somebody out there who's really smart is probably starting to work on some research and development for that. At this time, we don't have any way to reverse myopia. So once it's there, it's there.
Yeah. The next question here is, I use over-the-counter eye drops every day. Is this harmful?
It is not harmful with a couple circumstances on that one. Some people can be sensitive to preservatives in drops. So if that happens to be this individual, then it could be harmful if that preservative is being a little rough on the surface of the eye. So they do make preservative-free artificial tears. It also kind of depends on which artificial tear it is. There are definitely artificial tears that have better quality to them. Brand name artificial tears are definitely the best. There was some situations a few years ago where people were getting a lot of eye infections from generic eye drops. So two of my favorite brands are Refresh and Sustain. So if you're staying in, one of those families, you're getting a really good eye drop. Usually we tell people to avoid things like Visine because they can cause the eye to have some more rebound redness after the effects of the drops wear off. So Refresh and Sustain are two of, my go-to brands there. If you're staying in a safe one, you can kind of use that as often as you need to.
Okay. Next viewer question, what causes ocular migraines and what are some things you can do to help slow the progression of them, especially if you work outside?
Yeah, so ocular migraines, that's always an interesting one because it actually kind of falls more under the migraine world and the neurological world. And so they think it has something to do with vasculature, but we're not really sure, what causes migraines. But fortunately, the distortions that people see with an ocular migraine are like these zigzaggy, kind of light, kaleidoscope looking lights off to the side, and they usually last for about 20 minutes. So unfortunately, by the time you take something to make that go away, it's already gone by the time that medication would take effect. So usually with those, you just let them ride their course, but some people will get a headache afterwards. So you can use that ocular migraine as an opportunity to take a medication to make the migraine less severe.
And is myopia linked to any other eye condition or health issues?
Yeah, so myopia is linked to early onset of cataracts, retinal detachments and tears, glaucoma, and myopic maculopathy.
Okay. All right, we're going to pause the conversation here again. Remember, we are continuing to answer your questions that are vision related, also talking about myopia, and you can text those questions right here to the bottom of your screen.